Assalamu alaikum and good morning. Here we are in the second of the lecture series, Scoliosis in the Children and the Preliminaries. We'll be talking about the anatomical and physiological terms, the formal definition of scoliosis, anatomy of the spinal column, the types of scoliosis, conditions related to scoliosis, and we will be talking about the modeling of the spinal column, especially done by our research group. Let's talk about the anatomical and physiological terms. We have got 6 words which will be differentiating, and they will be coming in pairs: superior and inferior. Superior means an anatomical landmark like nose is above my chin. So my nose is superior to my chin. And the related word is inferior. So the chin is inferior to nose, and these are relative terms. The other one is lateral and medial. Something which is close to the midline of the body is medial, and which is far away from the midline of the body is lateral. So our ears are medial as compared to our shoulders. Our shoulders are lateral as compared to our ears. Got it? Next, proximal and distal. When we are talking about the point of attachment of a limb with respect to nearer that limb. For example, my elbow is proximal to shoulder. For example, if I have got a pain over here, so it is proximal to elbow point, and it is distal to the proximal to the elbow point and distal to the shoulder joint, because it is away from the shoulder and is close to the elbow joint. So these are the 6 terms. Now let's come to 3 other points: anterior point and posterior point. A point which is nearer to the front of the body, that is the anterior point, and the point which is closer or near to the back of the body is called the posterior point. Let's see, how can we say this is our eyes are the anterior point, like here in our ear. This is the anterior point because it is closer to the front, and the back of the lobe, this is the posterior point. This is posterior as compared to this. Abduction and adduction. If a body part is pulled away from the midline, that is abduction, and this is adduction. When it is held on closer to the body, so this is called adduction. Okay. And then some of these we will be talking in the next series of lectures, and I'll be giving you the reference of the complete file in which all of these terminologies are illustrated along with the word definitions in words and diagrams. Let's talk about 3 planes and then the 3 axes based on that. First one is called the frontal plane, and the frontal plane is dividing the body into the anterior and posterior part. Anterior, the one which is closer to the front, and posterior which is closer to the back. Let's say it is dividing the body into this half through this. Like my hands are now in the frontal plane, or they are representing the frontal plane. Transverse plane is the horizontal plane dividing the body into superior and inferior parts. Let's see. Superior and inferior. Sagittal plane is generally defined as the vertical plane which is dividing the body into the left and the right. Then these 3 planes would generate 3 axes. What would be the 3 axes? The 3 axes, let's see. Antero-posterior axis. The axis which is coming from anterior and its positive is in the posterior in this way. And how we can define this? This is a combination of, think about that. This is a combination of sagittal plane and transverse plane. Similarly, longitudinal axis, the axis like this. This is the intersection of frontal plane and sagittal plane. And then you have got a transverse axis this way, from left to right. This is the intersection of transverse plane and the frontal plane. Done? Okay. So these are the three anatomical axes, these are the three planes. And then there is thing which we'll be using in our examinations, physical examinations. So let's learn flexion and extension. The angle between the two parts of the body. It is describing the movement that affect the angle between two parts of the body. For example, in a scoliosis testing in anthropometry, an angle of 180 degree corresponds to extension. Any angle less than 180 degrees corresponds to flexion. So let's, I think, stop over there regarding the anatomical terms which we'll use in this part. Then in the next series of lectures, whatever else the other terms would be used, then we'll come to that. Now, let's come to the formal definition of scoliosis. And even before the formal definition of scoliosis, let me talk a little bit about the anatomy of the spinal column. The spinal column is composed of the 33 vertebra. And if you see the X-ray of the spinal column, there are small portions like cubes and they are interconnected, and there are 33 of them, and they are divided into 4 regions: cervical, thoracic, lumbar and sacral region. 7 vertebra belong, the top 7 vertebra belong to the cervical region, like starting from the cervix means neck, and the next 12 belong to the thoracic region. Thoracic region, it is the chest area. And then the next 5, they belong to the lumbar region, and the last 9 are located in the sacral region, which connects to the hip joint. And that's why when we write for the X-rays of the spinal column and we want to see where the curve is, so you have to have from the top to the bottom, and instead of top to bottom, we write in the technical terms as the AP X-ray antero-posterior, so that the back is touching the screen, X-ray screen antero-posterior, this means, and then the X-rays are entering from the chest antero-posterior, AP X-ray of the entire spinal column from external auditory meatus, this is called external auditory meatus, to hip joint, so that now the entire spinal column is coming in the X-ray and we can see where the curve is located. Now let's define the curve. The curve, the scoliosis now is defined is curvatures, lateral curvatures. Actually, lateral curvatures are in the frontal plane. If you see the X-ray of the spinal column or X-ray of the back, AP X-ray, like when I'm standing over here, a photograph like this is in the frontal plane, is the projection in the frontal plane, it should be completely straight. Now, if there is some curve, which we call as the lateral curve in this photograph, and it could be just one curve, which is called a C curve, or it could be a combination of 2 or more curves, then that is called the S curve. So these are the lateral curvatures. So these are the curvatures in the frontal plane. And it could also happen that the vertebra are rotated. And the vertebra are rotated, so this is called rotation. So before that, I think about 10 to 15 years ago, the definition of this spinal column is it is the lateral curvature of the spinal column. But now we have lateral curvature and rotations of the spinal column. So this is the formal and official definition of the spinal column, which is given by the orthopedic surgeons. The types of scoliosis, let's talk about. So these are infantile, juvenile and idiopathic, depending on which age range the scoliosis occurs or the onset of the scoliosis. If the scoliosis is present even before birth, maybe because of some dislocations of the fetus or so on, a compressing of the spine, and it is visible upon examination of the neonate, then that is called infantile scoliosis. It is present in the infancy. Then the second one is the juvenile scoliosis. In the juvenile scoliosis, that starts around the age of about 4 or 5 years, It could be present over there. It's called juvenile because it is present in children. But these are some very rare, there are not so many cases of infantile and juvenile scoliosis. The most important one, and on which we will be concentrating, is the idiopathic scoliosis. The word idiopathic means that we don't know really what is the cause of this scoliosis. It is there, it is hidden in over there, it is developing, just like you have got the moth which is eating the wood, and eventually from inside the wood is completely eaten up and there is nothing, and if you touch it, it really crumbles down. Similarly, the spinal column, if it is getting curved, the curvature keeps on increasing, and when really there is boom boom, which means that you really see that it is there, and then it is too late and your child is almost crippled. So the idiopathic scoliosis starts, and the people say sometimes around the age of 8 to 10, and it is easily detectable at the age of 10. So in Sweden, they screen all the children, 10-year-old, in the 4th grade and so on, and we start screening the children. Even I think in order to rule out some of the juvenile scoliosis, we do have some simple test during KG and class 1, but from class 2 onward we have got much more detailed and exhaustive testing. And this is the one which we are concentrating and finding the case finding of the type of scoliosis. I would really come up and tell you a little bit about the modeling of the spinal column, the type of modeling which we have been involved, our group has been involved in the modeling of the spinal column for the last 45 years. It has been done in United States, in Sweden and in Pakistan. Before that, the people have been looking at the Cobb angle and the X-rays and the spinal column in 2 dimensions, but this is a 3-dimensional problem. So our group, in fact, I presented an individual paper in March 1982 in which I proposed a 3-dimensional 3D static modeling of the spinal column. And almost 6 months later, a German group, Heilholzer and Luxman, they also put forward another static model of the spinal column in 3 dimensions using a different technique and different method, and the method of curvatures. Then in 1996, I presented a 3D dynamic modeling over the spinal column, which we will discuss in a little bit more detail in the next series of lectures about the gait of the children. And then most recently in year 2012, we have presented the crystal structure based model. In solid state physics, in crystallography, the crystal is related through the electron beam, electron density and so on, and this is a structure, it's a periodic structure. So we thought that we should be applying those ideas in order to study and model the spinal column, and this has been taken up very warmly by the group over there in the conference in which we have presented, and we still have to work more on this part. So here we conclude on this second portion of our lecture series, and then we'll come to the third portion of the lecture series in which we'll be talking of the scoliosis case finding. We will be discussing the physical examination to look for scoliosis, the inspection, the forward bending test, and the differential spinal function testing to rule out scoliosis-like conditions from this course. Thank you for bearing up with me, and look forward to be in the third lecture.